Hi there, I'm Durai, physiotherapist from National University Hospital. Today I will be answering some common questions that my patients ask about their ACL injury and how to care for themselves after ACL reconstruction. The amount of pain a patient feels after surgery varies from person to person. Your doctor will advise you to take painkillers for a few days to week after surgery to reduce pain and inflammation. It's common for bruising to be formed around the site of your surgery, maybe around the thigh, knee and calf, maybe 1 to 5 days after your surgery. Your doctor will strongly recommend that you take pain relief medication as prescribed for the first 3 to 5 days. You may give an ice pack to apply over operated site for the first 1 week. This is to help to reduce swelling. To reduce the whole leg swelling, the wound site, you may elevate your operated leg with a pillow. Your wound care nurse will advise that keep the dressing over your knee clean and dry. Please do not remove or change the dressing until your next appointment date. Observe for any bleeding over the wound site. Should there be any bleeding, please don't wait. Please call clinic during office hours or go to A&E after office hours. About 10 days after surgery, you will come back to hospital for a review with your doctor and your first outpatient physiotherapy appointment. Your stitches will be removed about 2 weeks after surgery. Rehabilitation starts in the ward on the same day after your surgery. After you are recovered from sedation, the physiotherapist will teach you simple knee range of motion to improve your knee mobility. They teach you quadriceps exercise to strengthen the thigh muscles. Ankle pumping exercise to prevent deep vein thrombosis, swelling management with a cold pack. You will be taught how to walk with the crutches, either non-weight bearing or partial weight bearing. Non-weight bearing means there is no weight or no pressure at all on the operated leg. Partial weight bearing means you have to apply partial pressure on your affected leg. If a ACL reconstruction plus meniscus repair, your doctor advised non-weight bearing for 3 to 4 weeks, so there is no weight bear at all. But ACL alone, you can allow to weight bear as tolerated. In the first 4 to 6 weeks after surgery, you may need to attend 1 physiotherapy session per week. After that, your frequency of your session will be based on your physiotherapist assessment of your progress. You may need to attend physiotherapy session for around 9 months, but the frequency of physiotherapy session may be reduced after 3 months of your surgery. For the first 4 weeks, You must wear the knee brace and use the crutches as per your surgeon advice. Because of your ACL graft is weak on your thigh muscles, has yet to strengthen, we strongly recommended that you wear the brace and use the crutch in order to reduce the strain on the new graft and prevent re-injury. Depending on the muscle strength gained and ability to walk with the crutches and the brace, the wearing of the brace and use of crutch may extend for another 2 weeks sometimes. You should wear the brace when you are walking and while sleeping. If you are seated or lying down and remaining still, you may remove it. You may shower after your surgery. Sit on the stool and remove the brace. Also ensure that your wound has the waterproof dressing applied to it. Do not immerse the wound site in the water. After you have finished showering, make sure you do not twist your knee when you are getting up from the stool. Okay, we hope this video has been useful to you. Remember to take care of yourself. To find out more, you can visit our website in our description below or check out other physio-related playlists on our channel. Thank you. Bye.